Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for joining me. I want to give you useful, helpful, and real information because it astounds me every time, but the information on the internet is terrible, really bad. And the comments you guys have been giving me about how you've been able to take so much from these videos has really been enlightening to me and shocking at the same time, if you can understand that. Today's topic, I want to empower you as a consumer of healthcare, how you can verify that your surgeon is the real deal. As you know, because expectations and the actual events, you always want things to match up correctly. So let me give you some background of what it takes to become a colon and rectal surgeon or proctologist. Colorectal surgeon, that's the modern term. Proctologist, the more old-fashioned term, but we're all the same thing, same doctor. Okay, I am a proctologist and a colon and rectal surgeon, in other words. So after medical school, you go into residency, and every colorectal surgeon in the United States of America needs to go through general surgery first. It is a 5-year training program. In general surgery, we are exposed to many different surgical subspecialties. So surgery is one specialty, and then it goes into more specialties underneath that. Yeah, the US health system is nuts, but a general surgeon unfortunately can't do everything well, and the amount of knowledge that is out there, it's impossible to keep up with all of it. Okay, so anyway, I'm getting off topic. The general surgeon resident will be exposed to things like trauma surgery, surgery oncology, hepatobiliary, trauma, transplant, and of course general surgery. And general surgery, the field in that is mainly gallbladder surgery, appendix, intestine, can do things like hernias. That's the bread and butter. That's what they do the most. But can general surgeons do colon and rectal surgery? Yes, and many people do, and it's well within their licensure to do these operations. But is there a difference between a general surgeon and a colon and rectal surgeon when doing these procedures or in the knowledge base or care? And I will say yes. Someone who has done a general surgery residency is not the same as a surgeon who has done a colon and rectal surgery fellowship program and also taken the exam. So I got a little bit ahead of myself there, but I want to really point out the difference that all our specialties are really very specialized and very concentrated. So after 5 years of general surgery, you take 2 exams. One is a written exam, which is a multiple choice exam, and another one is an oral exam where you have to answer questions in front of live people giving the test, and you have to answer all of their questions correctly. If you don't pass those tests, it's not good. You do not pass, and you cannot be a certified general surgeon, okay? And that's required before you move on to the next step. So after you pass that exam, then you can go into an additional year of training for colon and rectal surgery fellowship. This is an extra year of training where it's all focused on, you guessed it, colon and rectal surgery. And that's all we do. And this is because we've decided that this was the area of medicine that we want to be really good at. So of course things like colon cancer, rectal cancer, hemorrhoids, fissures, anal fistulas, colonoscopy, these are all things that we become experts on. After this 1 year, we have to take 2 more exams, okay? Another multiple choice test and another oral board exam. Again, you're in a suit, you're in front of big people in the field, and you have to answer their questions. And once you pass this exam, you are now a board certified colon and rectal surgeon, which of course I am. One thing I want to make sure that you understand is, like I said before, general surgeons can do colon and rectal surgery, and they will advertise it on their website, okay? And not everyone has access to a colon and rectal surgeon, but if you're looking for that specialist, a board certified colon and rectal surgeon, then there's gotta be a way that you can find this type of person, because the board certified colorectal surgeon, there is strict criteria that we have to complete and also take these exams to prove that we have the knowledge, we have the expertise in order to help you with these issues, okay? And so there's a lot of general surgeons out there who will advertise that they are a colon and rectal surgeon, and many people will automatically assume that they are board certified. I will tell you that some of these people are not, and the language on the website when you look at their credentials will be very misleading, which would make you think that they do have the certification, when I'm sorry, they absolutely do not. So the way they talk to you in terms of the options, the number of options they give you, the way that they do the procedures, because they weren't trained by colon and rectal surgeons like, for example, I was, it's going to be different. Just the understanding of how people poop, understanding of some of these oncologic principles will and possibly may be different. So I could go on and on, really I could, but I want to make sure you are clear about that, because you are a consumer of healthcare. You have choices and who you can see. So if it is important to find a board certified surgeon, colon rectal surgeon, then this video is for you, and I want to enlighten you on the differences that I did do extra training to do what I do and to have the extra knowledge base that I do have. So what I want to do next is actually take you to the computer screen, because there is a way you can check to see if this person has the certification, whether the person's gone through the training program and passed the tests, okay? And so to the computer screen we go. Okay, so we are at the official website of the American Society of Colon and Rectal Surgeons. And this is the website, which is, the address is www.fascrs.org. When you come here, you're going to be faced with the exact same homepage. I'm obviously logged in here because it's automatic. It says, welcome, Dr. Albert. Okay, so where do you go first? Well, the first place you should go is right here. It says find a colon and rectal surgeon right at the top. Okay, and this is very helpful because sometimes your medical doctor doesn't know all the doctors in the area. You know, they may not be in their normal referral pattern, so you may find it helpful to do some of your own research. So click this link and you'll find this right here. Find a colorectal surgeon. And you can put in the surgeon's name if you want, but I think what's helpful here is you just put in your own zip code and then put in how many miles. Okay, so let's put in my zip code here at the office. So 92705, and I say I want to look around 10 miles from this area. And that's really all you need. The other thing I want to point you to here is right here, ABCRS certified. ABCRS is the American Board of Colon and Rectal Surgery. This is the entity or organization that delivers the exam and keeps track of who is past the exams and who is a, you know, I guess a all outright colon and rectal surgeon. I can't think of another exact way of saying it. But this is how, if you click this box, this is how you can ensure the people that show up when you search have gone through a fellowship program and have passed the exam. So this is absolutely the type of person you want to be seeing. Then click search. So we're going to get a bunch of results here, and 92705 is in California, and so you start to see a bunch of locations around me, 10-mile radius, and then you're going to see the list of people just show up here. And you see I'm number 3 right here. And there's my address, which is, it's obviously I share it with you in the description box, but you'll see more people here in the area. One thing that's interesting is, so right now we have 15 results with the criteria, 92705 within 10 miles here, 15. But watch what I do here. I'm gonna unclick the certified button. I'm gonna search again. Look at this. There's 16 results now. So someone is not certified as a colorectal surgeon, but they're listed here. So this probably means that they have completed the training program, but maybe haven't completed the exam yet. Doesn't necessarily mean that they failed the test or anything bad like that, but this button is essential to click so that you get the right person the right time. Okay, and so I wanted to make this very clear to you. And so I hope that the computer screen website was very helpful for you. There's many situations where you kind of caught in an emergency situation. You really don't have the time to look things up on a computer. Maybe your cell phone has no reception in the emergency room, and they're saying they're going to call you a surgeon for your hemorrhoid problem, and you'd really like a colorectal surgeon, but you don't have the opportunity to look them up, right? What is another way, without having all this at your fingertip? Well, another thing I would say is ask that person straight to their face, are you a board certified colon and rectal surgeon? And see what they say. Now that is a point blank question, it's completely clear, and they should not lie to you at that point, okay? There's really no mistake. The other thing you can do is ask the nurse there if you're in the emergency room, can I borrow your computer to look up whether this person's a board certified colorectal surgeon? I just want to make sure I know who I'm seeing. The other thing you may want to do is look up reviews of people. I think this is so important. People believe these days, even though we're not living in the 1980s, 1990s, but many people feel like whoever they get is who they get, and they're kind of like, oh, I guess you're seeing me. I guess you're taking care of me. I guess I have no choice. I'm in the ER. I'm in pain. I'm struggling. I'm desperate for help. I guess that's it. And so many people feel like they're really painted into a corner, really pigeonholed to see the person that's in front of them. And sometimes it is that way because it's in the middle of the night, 2 a.m., and you're not just going to have a menu of doctors sitting in front of you and you say, I want Dr. D, or maybe, Dr. 4, I'd like that person, please. It's not working that way. However, if your condition is not emergent, then you have some ability to choose if there's some opportunity to wait. Maybe you can be admitted to the hospital. Maybe there's something that can be done in between where you say, well, I want to see a colon and rectal surgeon. I would like, and I'm not emergent right now, I'd like to wait and see that doctor. Or I would not prefer to see that surgeon. I want to see a different surgeon. What are my options? But reviews are incredibly important because you are a consumer. You have choices. In the United States of America, I don't know about any other countries, you have choices. And so you can always ask for other resources. You can always find out if there's other options. And so these reviews can be so helpful. In California, Yelp is huge, Google is huge, and reviews, people are passionate about telling each other about the experiences. And so if you can get a heads up on who is, who has great reviews, who really takes care of their patients, And then on the other hand, are there doctors that are really, really not, someone you can look at the reviews and be like, oh, that person, I don't think is going to be for me. I don't think that's a good match. And these are the kind of things that we, as a consumer want to know. I mean, a lot of doctors, I'll tell you, I'll be upfront with you, hate reviews, hate the information that's online. But me, I embrace it. Because you know what? This is 2022. You have to embrace it. And if you're going to show people that you're good, I should say, if you know that you take care of people well, you're not afraid of online reviews. I'll just say that right out front, okay? You're not going to be afraid of what people are going to say about you because you know what you're doing and you know that the reviews are going to be good. I work very hard for my reviews because that's just the experience I would want, and I'm always putting myself in other people's positions. The bottom end is not a fun place to have problems with ever, never, right? And so, taking that position, I'm always super careful, and I want to make sure I give that patient a good, great experience where they feel confident, they feel cared for. I'm rambling again. But again, it's what I'm really passionate about. And so anyway, I hope this video was helpful. I think it's super important to know who you're working with and what credentials they have, what licensure, because this is the way we standardize our healthcare and protect you as the consumer, okay? That's really what it's about. There's ways to make sure that you are getting what you're expecting, and the board certified colorectal surgeon looking up on the website is the #1 and official way to know if that person is the real deal or not. All right, well, thank you so much for listening to me ramble. I hope you have a great week. Take care. Bye-bye.